I have taken some time to look at the statistics of the COVID-19. That is from when the outbreak began in China, the spread to Italy and other parts of Europe, and currently the spread in America. One thing to notice that during all this spread in America and Europe, we had planes coming in directly from China to Kenya. We had planes coming in from Europe and from America. Therefore, there was that expected importation of the disease into Kenya. However, having looked at the patterns and the numbers that we have currently, it brings a conclusion that in Africa, the current strain of the virus does not have the same intensity and rate of infection as compared to Europe and to China. So this calls into further study, at least to determine why the strain of COVID-19 is not as significant in Africa as it is in Italy, in Spain, in America, and China. However, the reality is that if the virus came with the same intensity as compared to the other places, we would already have seen a rise in the number of viral or some form of pneumonia. We would already by now have recorded a number of unexplainable deaths. Even if we are behind in testing, at least we would have seen that there is some change in mortality in the country. We would also have seen some evident signs, like for example, the coughing, though we may not be able to test our cases in the numbers that should be, but we may not fail to see the symptoms. We may not fail to see a rise in number of deaths or something that would point to such an infection taking root in the community. So this calls for some further study, but the reality is that in Africa, COVID-19 does not show the same strength and intensity or rate of infection